Okay, so earlier I've talked about grounded theory. So grounded theory is a methodology in qualitative research. Now we'll continue with our discussion on the definition of nursing research. Excuse me. Okay, so let's talk about clinical nursing research. When I say clinical nursing research, these are researches that involves client and studies of the potential to affect the care of the client. Also studies with patient or the so-called normal participants. And then scientific method is considered to be the one source of nursing knowledge, and it is considered to be generally most reliable. Okay, so in this class, we're talking about clinical nursing research. Just take note that when I'm talking about clinical nursing research, this refers to the involvement of your clients. Okay, that's why it's referred to as clinical, because your clients are already involved. Now, these are studies with the potential to affect the care of the client. And the examples I've given earlier, this may be your studies about the effective management for bed sores, effective management for the reduction of the bacteria among your patients. This may also involve studies on drug studies. Okay, so these are considered to be clinical nursing researches. Now, scientific method is only the one source of nursing knowledge. We do not consider other sources such as haka-haka or such as your premonitions or whatever there as a source of your knowledge. We only rely on scientific method because your scientific method is considered to be the most reliable source for our knowledge. As I have mentioned earlier, when I say scientific method, meaning it follows a rigorous steps, okay? Follows rigorous steps. Next, there are two main kinds of research in nursing, okay? So by purpose, research could be classified as basic. It could also be classified as applied. Take note of the term basic and applied. When I say basic, your focus is the generation of new knowledge. When I say applied, it is to solve immediate problems, okay? Example, if I will be saying I want to know the intention of HIV, or no, let's say I want to know the intention to test by homosexual men, that is considered to be basic, okay? Because I only want to know their intent to test, okay? However, if I would want to know if guava is indeed an effective substance to reduce bacteria, that is considered to be applied research, okay? So the term or the definition is on the term itself. When I say basic, the intent is only to generate knowledge. When I say applied, it is being attempted to be applied in the clinical setting. Okay, so when you deal with interventions, it talks about applied research. Okay, when you just deal, if you want to know something, earlier you were talking about academic performance, you were talking about ano pa to kanina? Academic performance. Okay, the academic performance example is just a basic research. Okay, in your case, for your requirements for your requirement for your degree in BSN, okay, it does not really necessarily mean that you will be needing an applied research. Basic or applied research will do for your requirement. Okay. Next. Dahil ang class, kakalipat ako din ako maklik. Okay. The next is, so basic research generates new knowledge. Knowledge for knowledge's sake, develops, tests, and refines theory, often uses laboratory animals as subject, and then immediate application of results is rare. Okay, take note, immediate application of results is rare. Commonly, your basic research is also being referred to as preliminary studies, meaning after the result of this study, I could not really make an intervention. I can just draw a conclusion that I have a problem with knowledge, I have a problem with attitude, but at the end of the day, I do not know what is the root of that problem because it is only basic research. Now, for applied research, or look at this one. Okay, on my study earlier, the example factors associated with quality of life among children with epilepsy in Iloilo City. This one is only considered to be a basic research. Okay, I did not do any intervention to those children with epilepsy. What I did is only to find out the factors associated with their quality of life. I just found out if schooling status, is it related to quality of life? Is parental income related to the quality of life? Other than that, I did not attempt to find out if one specific intervention could help the children. Okay, this is just a descriptive research, hence it is considered to be a basic type of research. Now, for applied research, this is the use of new knowledge to the near future, and this is in fact the majority of nursing research in actual practice. Okay, this is the majority of your nursing research in actual practice. For example, there are researches wherein you would want to find out if which is more effective. Is it the 8-hour shift or the 12-hour shift? That can be considered an applied research because you have an intervention there, whether 8 hours or 12 hours. For example, if you would also want to know if what is more effective, is it the online class or the face-to-face classes? So that is considered to be applied research because there is an intervention being provided to your patients. However, if you would only want to know the level of depression of students during the pandemic, that is considered to be basic research. If you would want to know the effect of having a support system to the level of depression of students, that can be considered an applied research, okay? Because you would want to know the effects of communication, meaning you would instill what do you call this? You would have an intervention for your patients or your respondents. If I only want to know the lived experience of those blind people, that is considered to be basic research. You only want to know, okay? But if you would want to know the effect of touch to blind people, that is now applied research. Okay? So you need to be mindful on how you will be differentiating basic research or applied research. Next. So there is difficulty distinguishing the two purposes because finding basic research are sometimes applied quickly. And applied research findings actually lead to basic studies, and the difference is related more to funding than purpose. So this slide basically explains what is the challenge of applying basic research or applied research. The error or the fallacy for us is that I only conducted a basic research and here comes me applying it right away. Okay, for example, if my study found out, for example only, that the income or those with low income have low quality of life, I could not just recommend to the government and saying, oh, government, give money to all those people with low income because that will improve their quality of life. Take note that my study there is only relational. It's not causal. It does not mean that if you will become rich, you will have higher quality of life. It only said that those people with low income only have low quality of life. Meaning, I can focus my education there, I can focus my interventions to them, but it does not mean that making them rich would improve their quality of life. So that's the common fallacy. When you are writing your significance of the study, for example, okay, picture a study about knowledge on HIV AIDS. Let's say we are talking about knowledge on HIV AIDS. Here comes the students who will say, significance of my study. After this study, the knowledge of homosexuals would improve. That will be an error, okay? Again, the study is knowledge about HIV AIDS. Significance, you will be going to state, you're going to state, after this study, the knowledge of male homosexuals would improve. That is a fallacy. Take note that your research only attempted to find out their level of knowledge. Your research did not do anything towards the knowledge of your clients. Kumbaga, you only conducted a study, you just gave them a questionnaire. So you cannot say that one benefit of your study after your study is that their knowledge will improve. So ano tong questionnaire mo? Wala man to siya isang nagapaalam. Okay? You need to take note of that when you are doing your significance of the study. The common way for us to go around this fallacy is to state it like this. You will just state it as, the findings of this study can serve as basis. Okay, you just say the findings of this study can serve as the basis for the development of programs in HIV AIDS. You do not say again that your study will make them more intelligent about HIV and AIDS. Okay, that is a fallacy. Now, the last line there says, difference is related more to funding than purpose. Okay, this is again a fallacy. Okay, that makes it difficult for us to identify applied and basic research. Why a fallacy? Class, it is wise for you to know that if your research is applied research, more funding agency will be willing to fund your research. And here comes these other researchers who would just present their research as if it is an applied research, whereas it's only a basic research. Okay? So be careful with that differentiation. Next, goals for conducting nursing research. So I've mentioned this earlier. You have evidence-based nursing practice. Also ensure the credibility of our profession, accountability for nursing practice, and document cost effectiveness of nursing care. The main aim of most researchers also in the clinical nursing research is cost effectiveness. So earlier, I mentioned about the guava and the deodorant example. Diba, I posed to you the question that, are you sure that your guava will be a good substitute or will be a good competitor to the existing deodorants right now? For you to contest that your guava will be effective, you might need to present that your guava is cost-effective compared to the other deodorant available to us. Kung ang tawas, abi class, for example, tag 20, ang imuya guava, mabaligya mo tag 15, okay, that might make it reasonable for you to conduct your research. Okay, but that is just an example ha, base bala mag-guava research man kamo. Okay, next, methodological foundations of quantitative and qualitative research. So this will talk about knowledge and methods. There are two main kinds. Okay, don't confuse them. Earlier, there are two kinds of research that we discussed, your basic and applied. These are the types of researches according to purpose. Okay, so basic, it's just to generate knowledge. Applied, you would want it to be applied, as the term implies, applied. So those are the two types of research by purpose. You have basic and applied. When I talk about quantitative and qualitative researches, these are type of research by method. Okay, so meaning class, it is possible that my study is basic and quantitative. It's also possible that it's basic and qualitative. Okay, because these are different categories of research. Okay, quantitative. Quantitative research is geared towards objectivity, just like any research. There is tight control. Okay, take note of the term tight control. Findings of quantitative researches can also be generalized. Okay, and it is designed usually to collect numerical data. As the term implies, quantity. So we are collecting numerical data. We are not just collecting words here. You need to collect numerical data. Let's talk about generalization. The main difference between a quanti and a quali is the generalizability. Generalizability, that word class, the G of the findings. So when I say generalizability, the generalizability, okay, the generalizability. When I talk about that class, it means that if you're conducting a quantitative research, if you're conducting a quantitative research among male homosexuals, you are sure that the result of this study is applicable among all your respondents. Or if you have taken it from a bigger population, it will be applicable to the bigger population. Okay, that's what you mean by generalizable. Now, if I talk about qualitative research, okay, it is concerned with the subjective meaning and then the natural setting with a small number of research participants. So that's qualitative. When I talk about qualitative, for example, if you have conducted a research among male homosexuals, the product of my qualitative research does not mean or cannot be applied to all the male homosexuals. Kay take note, nag-interview ka lang ya anom kabilog or pulo kabilog. Kung isa dira sa theme mo, the end product of your phenomenological research is themes. For example, some of the themes that might emerge are, let's say, risk aversion. If you know that your male homosexuals that you have interviewed are risk averse, meaning they would want to take risk, calculated risk, okay, this finding of yours is not applicable for all the male homosexual because what you have conducted is only an interview. Okay, you've conducted only an interview to a limited number of people. Okay, that's why between the two, quantitative can be generalized to all, whereas qualitative could not be generalized because it only involves small number of participants. Okay. Okay, so this one is one study. This is a study of Suganov. This is also among my advisee in a master's. Okay, so his study is on the differences in the perception of end-of-life care issues between patients and family members. So our focus here, class, is this. Okay, when we are dealing with dying patients, okay, you would encounter usually cases like the patient would already want to die, they would already want to rest in peace, whereas the family members are still fighting. Okay, so we had that rationalization on our problem. So we were thinking that we are thinking of the cases that we have encountered in the ICU, wherein the patient would want to sign the DNR, or the do not resuscitate. However, the family members still want to spend all the millions that they have that actually do not even exist. Okay, so we had this study, and actually one of the findings of this study is that, okay, one of the findings of this study is there is really a difference on how they perceive end of life care. Okay, oftentimes ang fighter gid man is ang family and not the patient. Okay, in this case, if I would look at this study is considered to be quantitative because of the term there, difference. Okay, um, okay, if I talk about differences, meaning I talk about numbers, that's why it's quantitative. Whereas, if I will classify this whether basic or applied, this study is considered to be basic. Okay, because we did not do any intervention, we just determined the way they perceive end of life care issues. Okay, so we just determined if sino ang nanamian magpa-NGT, ang family member or ang patient mismo. Sino nanamian magpa-intubate, is it the family member or the patient mismo? Okay? So as you can see, class, we had actually difficulty on this study. Good thing we were able to reach about 60 participants because our focus are those who have, our respondents here actually are patients who are stage 3 or stage 4 cancer patients. Okay, so if you are embarking on those kinds of research, you need to check among yourselves if indeed you can reach these participants. Okay, my student here has traveled the entire province just to look for participants. Okay, we used a snowball sampling, if you're familiar with the sampling methodology. But anyway, we'll be discussing that soon. Okay, so in the past, nurse researchers have primarily conducted quantitative research. Okay, number of nurse researchers who have conducted qualitative researches has also increased. Okay, now what do I mean by that? I for one's class, okay, when I was on my undergraduate years, I am not a believer of qualitative research. I just think that qualitative research could be a waste of time. Okay, but with my exposure in research, I came to realize that there are things that could not be easily quantified. And for you to understand these things, you need to have qualitative researches. Okay? The thing in qualitative research is, if you are the researcher, you need to empty your mind of your preemptive thoughts. Okay? For example, if you will be conducting a qualitative research among, what's the appropriate term for commercial sex workers? Okay, I think commercial sex workers and not prostitute. Okay, let's say that's the appropriate term. You want to the lived experience of commercial sex workers. Hindi pwede, class, nga deep inside your mind, you condemn these people, and deep inside your mind, you think that these people are immoral. If you are thinking of these things should be indicated in the journal so that whoever will be critiquing your research later on will be able to see the journal and then find out if it is your personal thoughts, or indeed it is that of the clients or respondents that you were able to capture. Okay, that's the challenge in your qualitative research. And also, I've mentioned, I came to realize that there are really things that could not be quantified. Okay, so hugot nyo na sa life nyo and also sa research. Okay, next, sources of nursing knowledge. I was able to touch little of this. So tradition, when I say tradition, handing down of knowledge from one generation to another. This is not what we advocate for. Okay, this is not what we advocate for. Next, experts or authorities. In the past, we usually look at the physicians as authorities. But today, we have a unique body of nursing knowledge. That's why we have our unique set of nursing theories. Also, when I talk about expert, let's say, for example, right now, you might be listening to me, you might be considering me as an expert on this subject. But if there is a book, class, that could be contradictory to what I am saying right now, it is the book that you will be following, and it is not me. Okay? So that's an example. For example, you'll be listening to speakers there on the seminars. Okay, they are expert, they are authorities, but if there is a research that supersedes what they are telling you, it is the research that would take precedence, or it is the research that would take authority over to the expert opinion being given. Okay. Next, trial and error. Trial and error means discovering of knowledge. So reasons for success or failure is not determined. Okay, what do I mean by that? Or what do we mean by that? So for example, in the past, they will just say, kung if your patient now is having insanity, their tendency in the past is to do triphening. I'm not sure if the term is triphening, triphening. When I say triphening, what they are doing is they place a hole through your skull. And then they believe that this hole in your skull could relieve you of the pressure inside your skull. Di kung napatay to siya class, sorry, ipatay siya kay because it's trial and error. Okay? So again, right now, we do not do your trial and error. Okay? We have the term clinical trials, but your clinical trials is different from trial and error. For a clinical trial to pursue, it needs to have preliminary studies. Okay? Preliminary studies. Okay? So in preliminary studies, again, those are studies conducted among animals or in the laboratory setting. So class, if you will be asked what is more reliable between the three, okay, among the three, what is the most reliable, I mean, okay, the correct answer there would be trial and error. Okay, the least reliable will be tradition. But if the choices would include research, all of them are not reliable. You will be answering research. Okay, in board exam, you will encounter questions like this. Okay, which of the following will be a credible, or which of the following will you choose as a source of knowledge? So if you only get to choose between tradition, expert, trial and error will be the best answer. However, if you have research in the choices, research will be the best answer. Okay? Next, scientific research, I mean. Okay, for your scientific research, researcher uses systematic, orderly, objective methods. Okay, paulit-ulit. Scientific method is based on empirical data. And when I say empirical data, this usually talks of numbers. And then that is with the use of your five senses. Okay? So for your five senses class, you know your five senses. So hindi pwede nga mahaom-haom ka lang daya ka maghambal nga, ma'am, ano sa pamatsyag mong imo nga bed sore? Is it big or not? Is it painful or not? You need to have tools to measure empirical data. So you write there in your notes, when I talk about empirical data, there needs to be tools. When I talk about tools, your tools could either be in the form of questionnaire. It could either be in the form of interview schedule. It could either be in the form of an assessment tool, such as your pain rating scale, your not Morse. Do may Morse ba lang a fall rating scale? Okay, please check on that if what is the fall scale. If I'm not mistaken, or I might be confusing it with Morse code. Morse, huh. Okay, and then all other assessment tools that we may have. Then, researchers' opinions and personal biases should not influence the findings. So, hindi pwede class, for example, nga may kainit ka tuya sa blind person, ipaupok mo dira sa iya during the interview. Because as I have repeatedly emphasized, you should be able to separate your personal biases. Okay? Next, your scientific research is also similar to your problem-solving approach because we identify problem areas. We establish plan of action, we collect data information, and then evaluate data results. Okay? So what do you mean by this? It is not possible for you to just collect data. For example, mahambal ka, makadto ko guro sa field. Gusto ko ya mag-collect data on the mortality of children, or I want to collect data on their breastfeeding problems. Okay? You could not just collect the data without identification of the problem. So maybe on that example on breastfeeding, I can say nga, my problem in Barangay X is there are a lot of incidents of malnourished. Okay, there are a lot of malnourished children. So if that is your problem, maybe you need to check on the feeding practices among these children. So there needs to be a problem identified before you collect your data. Okay? I have encountered researchers who would say, collect ka lang data, karon lang na ang problem. Okay? That cannot be. Okay? You need to have direction on what data you will be collecting, and that is to be guided by your problem identification. Okay? That is to be guided by your problem identification. Next. varied purposes. So there are different purposes. So it could be specific in scope. It seeks a solution to a problem and uses knowledge for people in a specific setting. Okay, so this knowledge could be used for people in a specific setting. Take note, although I talk about how generalizable the data is earlier, take note that rarely can you find a research that is applicable for the entire world. Okay, for example, I conducted a study on the level of depression, for example, of BSN 3H. Let's say, for example, 3H. When I found out that 3H have an incident of depression, I could not conclude that all student nurses have depression. Okay, so take note that the knowledge there for people is only applicable to a specific setting. Okay, and that the determinant for that to whom it will be applicable is your sampling methodology. Okay, you write on your notes the determinant for the applicability is your sampling methodology. Okay, we hope to touch on sampling on the next sessions that we will have. Okay, also it might be broader in scope. It obtains data for generalization and also apply knowledge to other people and settings. Now, this is a recap on the levels of evidence. I'm not sure if you were able to touch this in your theoretical foundations in nursing, but these are the levels of evidence. Okay, the major reason is to foster optimum care for clients. Okay, the major reason is to foster optimum care for clients. Okay, so you have the term EBP. Excuse me. You have the term EBP, evidence-based practice, and then you have the term evidence-based nursing practice. This has been the inclination for the past decade, which means, class, that everything that we do in nursing research or in nursing practice, should be bounded to research, even in nursing education. Okay, as an example, I have attended seminars from other schools. Okay, the methodology that they are using in their. Okay, so those are some of the purpose. Okay, okay. In a while, so clinical decisions are based on best research evidence, nurses' clinical expertise, and then healthcare preferences of clients. Okay, then the aim is to provide the best possible care based on the available research. Okay, best available care based on the best available research. Okay? So class, although gahambal ako nga ang mga practices naton is evidence-based practice, no, it does not mean that tanan naton nga ginaubra dira subong sa ospital may research gid. Okay? Pero kung once may research, amo na ginasunod naton. Okay? I don't know if you've heard of research universities, but when I talk about research universities, they are very serious on the conduct of research. Let's say, for example, this experience of my colleague in Saudi Arabia. Okay, you're familiar with albuterol, right? Albuterol or epinephrine. Okay, you might be familiar of albuterol. So they are trying to find out if what is more effective, administer albuterol via PAI or administer albuterol via IV. And they are doing this to their actual patients. Okay, I was asking, how is it easy for you to do that? Because they say that their hospital is a research-based hospital. Okay, it is a research hospital and it is being financed by the government. Meaning, for the improvement of everybody, they can do experimental researches anytime. Okay, here in Iloilo, I have known an experimental research class. Okay, they tend to pay you a good sum of money if you will just be administering the medications. However, there are a lot of ethical considerations here because if you are the one administering the medications, there is some researchers or research that we call double blind. Okay, I will write on, sorry. Okay, there are double blind researches. Okay, when I say double blind researches class, for example, kung ako ang mahatag sang bulong, okay, the researcher is not informing me what kind of medication is this. Okay, the purpose of that is so that I could not fabricate the results and then make up the results and then just say it's effective to my patient. So they would just give me a drug and then they will tell you just give it. We know it's safe. We already talked to the patient. The patient gave consent. You gave this drug. So this is a double blind kind of research. Okay, so those are some of the ethical considerations that you will be having later on. Next, nursing profession exists to provide a service to the society. Hence, it should be based on accurate knowledge. Okay? Research determined to be the most reliable means of obtaining knowledge. So it is the most reliable means of obtaining knowledge. Take note ha, hindi ang chismis, hindi ang hambal ni sir, but it is the research, which is the most reliable means of obtaining knowledge. Okay? While we are having our discussion, maybe you would want to embark on researches on education related also to COVID-19. That is one area that you can possibly explore. Okay, so this is the pyramid of evidence. I am not sure if this is pronounced as salmon or salmon. Okay, but from Madam Susan here, okay, Susan here is telling us that these are the levels of um, evidence. Okay, when I say levels of evidence class, according to Madam Susan here, okay, the higher you are in the pyramid, the more reliable your evidence is. Okay, the higher we are to this pyramid, the more reliable the evidence is. Okay, so in this case, if you would look at it, the lowest form of evidence shown in this one is your qualitative studies. Okay, your program evaluation and then your opinion surveys. They are considered to be the lowest kind of evidences. Class, not because it's lowest, I'm discouraging you to do it. Okay? I'm just telling you in such a way that later on, if you will find a research, kag maghambal abi nga, wow, guava deodorant is effective. And then it turned out to be a qualitative study nga nag-interview mo lang siya gali kung effective ang guava nga deodorant. Okay? So you will not be doing that. Okay? You will not be relying on that. Okay? Alone, because that is the lowest form of evidence. When I say program evaluation class, it's just like, for example, after our BLS, I've gathered the data. I've determined if what are your feedback on my BLS training. For example, I have the data right now. I tried to run the data using SPSS. I found out the area that I need to improve there. Okay, that is just program evaluation. Okay, that is a low form of evidence. And then opinion survey, for example, during elections, okay, whom you would want to become the president or who you would want to become the vice president of the Philippines. Those are just opinion surveys, low form of evidence. Okay. When I say case-controlled studies, okay, these case-controlled studies have their specific controls. Okay. They tend to be more reliable to your qualitative studies. Now, cohort studies. Okay. So for your case-controlled cohort studies, I mean, when I say cohort studies, these are studies conducted between groups. Okay, so a study was conducted in group A, and then you are conducting another study, or no, sorry, repeat. When I say cohort studies, these are studies conducted on different groups. Let's say, for example, I want to find out the effect of substance A in the lowering of blood sugar. I conducted that study among Ilonggos. Okay, and then later on, I will be conducting that study among Cebuanos. Later on, I will be conducting the study among Chinese people, among Americans. So these are considered to be cohort studies. And if I found out that the results are consistent among these different groups, I can say that my study is reliable. Okay, let's go to randomized controlled trials. Your randomized controlled trial is one of the example or pillar of your experimental research. So when I talk about experimental research, as I mentioned earlier, there are 3 criteria for you to have your experimental research. So that is randomization, control, and manipulation. Okay? Okay, to this. Now, systematic reviews. Class, for systematic reviews, there are 2 main kinds of systematic reviews. You write in your handouts that the 2 kinds, well, handouts, as if may handouts ka mo. Okay, you write there in the panet of your sagging class that you have your meta-synthesis and then your meta-analysis. Okay, meta-analysis and then meta-synthesis. Okay, um, these are what you referred to as systematic reviews. Okay. Okay. Nagpangamuyo ko danay class. Now, for your meta-analysis is an amalgamation of quantitative research. Your meta-synthesis is a synthesis of your qualitative researches. So when I say systematic review class, this is This is a combination of all the researches found, found or done worldwide. So meaning, these are researchers, for example, somebody conducted a study in the Philippines, another conducted a study in China, another in the US, okay? And then all of these studies will be lumped together. We will try to find out what is consistent among these studies, what is different among these studies, okay? That is what you call your systematic review. Kung baga class, your systematic review is a review of several studies. Okay, it's a review of several studies to check the consistent results between these studies. Okay, and then the bottom line of all of this is the formulation of guidelines. Okay, just like right now, there are a lot of studies conducted about COVID, and the bottom line of those is to formulate guidelines. So when I talk about guidelines, your guidelines should be backed up by these lower levels of evidence, because a guideline could not exist without the support of these lower levels of evidence. Okay, class, if you would want to embark on systematic review, by the way, okay, there were a lot of people encouraging me to conduct a systematic review. I find it tedious. However, if you would conduct a systematic review, your respondents, quote unquote, okay, your respondents, quote unquote, will be the studies of others. What you do in systematic review is find all the researches, available online related to the topic that you want. For example, if I want the quality of life in epilepsy, okay, I would have, for example, 1,000 studies available online. And then I will have my criteria there on what studies I will be including. If I will say that my study will only be from 2005, manaro down mo siyang 1,000 pakadto sa 700. If you would only want to focus to children, until you narrow it down until you have about 100 researches, and then you compare the results to one another. Okay, that is the effect of your systematic review. So if you will be doing systematic review class, you don't need to conduct a research per se. Okay, what you will be doing is you need to check on the methodologies of existing research and then check if what is consistent and not consistent among these findings. Okay, I hope I'm making myself clear there. By the way, class, on the case-controlled studies, no, I was trying to find out what is a case-controlled study. Okay, so class, a case-controlled study is actually, there's a two group wherein one with the outcomes or disease and one without the outcomes or the disease. So basically, this can be comparable to your comparative study. Let's say, for example, I would want to find out if what is more effective. Is it the counseling or no therapy at all? So if I would want to compare counseling with no therapy at all, that is considered to be a case-controlled study. Okay, let's say I have a group of 30 people there, and then 15 people will be assigned to counseling, and then the other 15 will be assigned to no counseling, and then I'll be comparing them. That is a case-controlled study. The difference of that on a cohort study is that, as I have mentioned, a cohort study is conducted among several groups, okay? Usually between races or between countries. Okay, I hope I made that clear, and then I hope that you will realize that systematic review is among the best forms of evidence that we have. Okay, plus there are actually different versions of the pyramids of evidence, but this is the one that is being utilized right now by your teachers in research. By the way, I was thinking earlier if who is the father of evidence-based practice. That is a very common board exam question. If I'm not mistaken, it will be David Sackett. Okay, David Sackett, which is the father of evidence-based practice. Okay, it's David Sackett. Okay, just things that are nice to note for your end, but sometimes it comes out in the board examinations also. Okay, now, ensure credibility of the nursing profession. I've mentioned earlier that one of the attempt of research or one of the goal of research is to ensure the credibility of nursing profession. Okay, take note that we are considered to be a vocation, establish own body of knowledge, distinct from other disciplines, and then research helps determine uh, what makes nursing profession unique, and it is ranked highest on honesty and ethical standards. Okay, so us nurses are considered to be the highest on honesty and ethical standards. I would like to believe so until to this point, class. Okay, so kindly uplift that part there, that we are still the highest on honesty and ethical standards. Okay, that's why our research is bounded on credibility. Okay, next, provide accountability on nursing practice. So this increase independence. This will give you to have sound rational actions, and then you will have the responsibility of keeping knowledge base current. Class, when I say a current knowledge base, we assume that knowledge changes every 5 years. What may be true 5 years ago might not be true at present. Okay? Tandaan nyo na class, 5 years lang ko, no? Okay? So when I talk about review of related literatures, we do not encourage students. For example, right now it's 2020. We would encourage you to have your literatures reviewed from 2015 to 2020. In my case, if I will be your advisor, I can give you up only to 2010, but I will not allow you to have references older than 2010. Okay? So that will be futile on our part because, as I have mentioned, knowledge changes every 5 years. That's the assumption. Okay, introduction. So clearly defined research problem area is not typical. Okay, mistake to try to examine too much in one study, and then the number of potential nursing studies is infinite. Now, excuse me. So in this case, the message of this slide is that your first problem in your nursing research class is that you don't have a problem. Okay, your first problem is that you don't have a problem, because a clearly identified research problem area is not typical. Okay, I know most of you are thinking of a lot of problems. May hambal, may problem ka sa love life mo, may problem ka sa MS mo, may problem ka sa pandemic, may problem ka sa academic freeze, tanan na lang kamo may problem. Tanan kamo damo problem nga madumduman. But by the time that you will be asked, okay, to identify the specific research problem, you will have hard time initially to answer this question. And then we have this mistake that we try to examine too much in one study. For example, I want to deal about academic freeze. And then here comes me doing my related literature. I found out that there's a problem on socioeconomic status. I found out there's also a problem related to depression. I found out there's also a problem that might be connected to personal relationship with the family members. Pag ubra ko sang research ko, tanan nga nga factors, I listed it up there. And then later on, you will realize that you tried to examine too much in one study. Okay, class, when you are dealing with variables, okay, it does not mean that if you have a lot of variables, you are conducting a very good research. Okay, your variables need to be narrowed down. You need to be focused on specific variables and try not to examine too much in one study. Because take note, in your case, for example, you only have a semester for you to discuss this proposal, and then you have the next semester for you to conduct your research. You do not have your entire lifetime to talk about all of these factors. I have known of one study, if I'm not mistaken, I've heard it in TED Talk. I don't know if you're listening to TED Talk. A study about happiness and also a study about grit. Okay, these studies were conducted for around 10 to 20 years. So nagkakatabo class na may napatay na ng ilang researcher, gin-endorse na sa next na researcher, hasta sa next na researcher. So there are studies like that. Okay, so you need to consider the number of variables that you are taking into consideration. Now, there are a lot of studies that can be conducted in our field in nursing. Because take note, you're not only limited in the hospital setting. You have the CHN, you have the community setting, you have the education setting, you have the academe, you have the hospital administration, all those things. Almost all, if not all of the topics could be connected to nursing, especially the health problems. Kadamo-damo sang pwede i-research. However, okay, you need to focus on one topic. Oftentimes, damo ka madumduman i-research, pero kung ipa-focus ka na, you will have difficulty. Okay? In your case class, you might want to open this document, okay, the NURA and the RURA. RURA. NURA is National, let me say, National Unified Health Research Agenda. RURA is a Regional Unified Health Research Agenda. Class, when I talk about NURA and RURA, these are the research topics that the Philippines would want to focus on at present. The last version of this one that I have seen is last 2019. Okay, that's one area that you might want to consider if ever you would want to conduct your research or determine what area is researchable. Next, the critical first step for you is to delineate the study area clearly, okay? And state the research problem concisely. You could not tell me that, sir, I have problems in COVID-19. What about COVID-19? You need to tell me if is it about the management? Is it about the drug? Is it about the reaction of the people? When you say, sir, reaction of the people, what about the reaction? There are a lot of reactions. Is it the physical reaction, emotional reaction, mental reaction? Okay, you need to be specific when you are talking about your research problem. And then you need to delineate the study area. For the study area class, one particular example that I usually give to this is, if I have students conducting research, I would usually ask you to go to the PHO. Okay, for example, given that there is no pandemic right now, okay, I would advise my student to go to the provincial health office. And then I would ask my student to get statistics from the provincial health office, if not from the provincial health office, from the city health office. Okay, for example, I had one supervised a study on dengue. Okay, we want to know about dengue. There are a lot of cases about dengue. So we want to know the practices of people on dengue. What we did was, I instructed my student to go to provincial health office and then find out in what municipality is there a very high cases of dengue. Okay, class, if I want to study about dengue, I would not want to go to the entire province of Iloilo just to conduct that research. Okay, to conduct that research, I need to identify the study area. So in that case, to identify the study area, hindi mo ko pwede kambal nga. Maybe I will do draw lots. Kung diin ako ma-study, okay? I could not just do that. Okay, so one thing that you can do is go to the PHO, determine the statistics, in what province is there, or in what municipality is there high cases of dengue. That's one way for you to identify your study area. Class, right now, since I know you could not go to to PHO, you can visit the website of Philippine Statistics Authority. Philippine Statistics Authority is the new name of your NSO. If you have noticed, you don't have your NSO certificate already, your birth certificate should be PSA authenticated. So these are the possible areas wherein you can find your research. The Philippine Statistics Authority, as far as I'm concerned, have published researches up to 2018. Okay? They have published they have published statistics up to 2018. Okay? So, okay, take note of that. So areas there that you can find out is, may nutrition problems sa ini. Or you can find out there, neonatal death rate is very high in this province. Hence, you will be able to know if what kind of study will you be conducting. Okay? Next, it is difficult for beginners. I have to tell you that. Okay? We might ask you to prepare 3 nursing research problems, and then please don't get or don't feel bad if your research problems, if all 3 of your research problems will not be approved. Okay? If I am the one evaluating your research problem, my first question for you is that, by the time you present the research problem, I will ask you, so what? Okay? If you have presented a research problem to me, I will just ask you the question, so what? So what if you will conduct this research? So what if we will know this research? So what if we will know this finding? What then can we do next? Okay, so kung sa amon pa mga researchers, we say, ti ano dayon? Okay, what if you will be conducting that? What if that will be approved? So what? Okay, will it have an impact? Okay, that's the first question that you might want to ask yourself too. Now, expectation for nursing student is to identify problems appropriate for nursing research studies. Sources of nursing research problem. I give an example earlier, personal experience. That could be one, okay? But you do not just jump because of your own personal experience. Or let's say, for example, you've noticed no, that during this pandemic, there are a lot of people communicating to you and then they have incidents of depression, quote unquote, okay? For you, they are depressed. This is your experience. Because of this experience of yours, that will trigger you to search for literature. And then if the literature indeed says that there are some Filipinos who are depressed, okay, conflicting literatures. Okay? Maghambal kang isa nga, hindi na sila depressed. Ang isa ay saying depressed. Conflicting literatures could be a source of your research problem. Okay? Existing theories could also be one. So when I say existing theories, Ma'am Balkabi, Florence Nightingale theory have not been tested for long. I would want to know if Nightingale's theory way back in the 1980s could still be applied on the 20th century. I would want to test on that. I would want to know if Florence Nightingale's theory might be still effective on addressing the COVID-19. You would want to test on that, okay?